This presentation looks at the function of the urinary elimination system, indications for dialysis, alterations in the urinary system, nursing assessment, diagnostics, and interventions for common urinary problems, and the use of urinary catheters. The urinary elimination system depends on the function of the kidneys, ureter, bladder, and urethra. All organs of the urinary system must be intact and function for successful removal of urinary wastes. Intact efferent and afferent nerves must also come from the bladder to the spinal cord and the brain to promote normal urinary elimination. Please be sure to review normal physiology of the urinary elimination system and the functional unit of the nephron. Remember that normal urine output is 12 to 1500 milliliters per day, and less than 30 milliliters per hour is an indicator of renal problems. Special considerations for the functions of the kidney include the production of erythropoietin, which helps maintain red blood cells, the production of renin, which helps maintain blood pressure, and the effect that the kidneys have on calcium and phosphate regulation. These are important because patients with chronic kidney disease can have problems with anemia, blood pressure, and they can have problems with calcium absorption and renal bone disease. Brain structures that influence bladder function include the cerebral cortex, the thalamus, hypothalamus, and brainstem. These structures inhibit or allow voiding to occur. Normal voiding requires contraction of the bladder and coordinated relaxation of the urethral sphincter and pelvic floor muscles. It's vital that nurses understand the process of normal voiding to be able to assess and determine which form of incontinence or which bladder problem may be occurring. Remember that normal bladder capacity varies, but is generally 600 to 1,000 milliliters of urine, and a normal person can void every 2 to 4 hours. Incontinence is classified as functional, overflow, stress, urge, or total incontinence, and each type has a very specific nursing intervention. Damage to the spinal cord above the sacral region causes reflex incontinence. This condition causes loss of voluntary control of urination, but the matricuration reflex pathway often remains intact, allowing urination to occur without the sensation of the need to void. Factors that influence urination include disease conditions, medications, medical procedures, and fluid balance. Socioeconomic factors and psychological factors such as anxiety and stress can also influence an individual's ability to urinate. Conditions that affect urine volume and quality are generally categorized as pre-renal, renal, or post-renal in origin, whereas any condition causing decreased blood flow to the kidney is pre-renal, any problem with the kidney itself is renal, and any obstruction in the lower urinary tract that prevents urine flow from the kidney is post-renal. Some older men suffer from benign prostatic hyperplasia, which makes them prone to urinary retention and incontinence. Over time, prostate enlargement can hinder bladder emptying, causing bladder overactivity and possibly causing the bladder to not empty completely. Hyperreflexia is a life-threatening problem that affects the heart rate and blood pressure. It's caused by overfull bladder. It's usually neurogenic in origin, However, it can be caused by a functional blockage. Conditions of the lower urinary tract include narrowing of the urethra, altered innervation of the bladder or weakened pelvic and/or perineal floor muscles, that urinary elimination. Other problems that can affect a patient's ability to urinate include physical limitations or degenerative joint disease or Parkinson's disease.